over the last 6 months, there must have been some things that you felt were fantastic, some things that were done really well, or people who dealt with you as well as the illness, the cancer.
Mm-hmm.
What were the good bits?
I suppose the good bits were my oncologist. I always praise him and his registrar. They've been fantastic, very approachable, very much concerned about how I'm getting on. I can call them and they'll always contact me straight away if I've any anxieties or any concerns about anything. They've been fantastic on the journey. The nurses in the oncology unit, when I'm in the day centre, they've been great. I can pick up the phone and ring them at any time. They've been very helpful. But funnily enough, it's the other patients that I get a lot out of when I'm in treatment, like their side effects. And I might be a week ahead of one person and I'll come in and I'll say, oh, my nails are starting to lift. It could be something like my nails are going brown, they're starting to lift. That person won't experience that, but then she'll come in with the same complaint the next week. Somebody's a week ahead in the journey and they're kind of advising you what could be coming next. So I got a lot of my knowledge from the actual patients themselves when we're sitting around for hours on end discussing it, which is, I know that's unusual, but, well, it's not unusual, but I got more, I suppose, from the other patients than I did from anybody else because you've so much time with them.
And of course, they have got first-hand experience.
Exactly.
Yep.
We're all in it together.
Yep.
Yeah.
So really, we're talking about something called survivorship.
Yes.
That you've finished the treatment, you've been through the scientific, physical, we are going to do this and this and this and this. You've had great support from the oncologist and from his registrar. You've had great support from the breast care nurses. But now that you've finished treatment, is there regular follow-up for you, or is it something that you feel you've got to try and manufacture yourself?
Well, my follow-up is just with the oncologist. My next appointment now is in 3 months, but nobody ever spoke to me about extra support or resources that might be available. Like, something I found would be really helpful would be, for me, I think it was a touch of health anxiety I got. Where do I go with diet? Exercise. What do I do to help my well-being and physically make myself as fit and healthy as I can be? But nobody has ever suggested speaking to a dietitian, a nutritionist, anything like that, which I think would be great. Like that, a survivorship program where when you finish treatment, you've other resources to help you move along on your journey, be it if people had financial difficulties, to speak to somebody in that line. But I think definitely a health program would be really advantageous.
When we talked last time, you mentioned that you'd gone to a counsellor who you found yourself.
Yes.
When do you think you would be ready to go back? You said that you may, but you're not at that point yet. When would you go back, and what sort of help would you hope to get?
I will go back. I was thinking maybe January, the new year, but I now think I'll wait until the treatment is coming to an end, because that is when mentally you need support the most. For me, it's treatment is finished, you're on your own. You have your checkups at the hospital and your annual exams, but for me, it's when the treatment finishes, I take over from there. That's when the control is back to me to look after myself physically and mentally and set goals. It's tiring going through this mentally. You're not able to make big decisions like that. But I'd like to set some goals. But I think the best time to do that for me is when I'm physically stronger and more able.